Hello, my name is Patrick McDonald, and I'll be discussing databases in blood banking. Specifically, I'll be talking about their role in the healthcare system. I'll show you example of an architecture of a blood banking database, and I'll also discuss some important aspects of normalization constraints within these databases. I'll also discuss certain organizations and what types of databases they use. I picked databases in blood banking because I have a background in the medical field. I was a medical laboratory technician for 15 years in the Air Force, and I worked closely with databases and saw how important they were to giving our patients good quality health care. I also understood that if any of these databases integrity was ever compromised, that it could mean serious consequences for our patients. Databases act as sort of lifeblood in the healthcare system, no pun intended there, because they can track every aspect of the blood donation process, be it the donors, the patients, even the employees, the procedures, and the types of blood products that are being donated, as well as where those blood products are being stored. It can track all those things, as well as allow healthcare workers to apply quality assurance and quality improvement concepts to better take care of their patients. The architecture of a blood banking database can almost be broken down into a timeline, different timelines that kind of converge together at a point. There's the donation process, the transfusion process, and then there's also the process of storing the blood bags. A donor has a donation, they give a donation, and then that donation is then kept in a permanent record. Patients that receive transfusions will undergo these procedures, which is then also maintained in a permanent record. Blood bags also have their own unique identifier from each patient that we get them from, and they are also stored in a unique location with its own identifier, with its own unique code, like for instance a hospital or a donor center or even a distribution center. Normalization constraints are extremely important in a healthcare related database because any anomalies that occur or any kind of human error that can occur when putting in information can result in detrimental consequences for patients. It could lead to serious injury or even death. Two types of organizations that use these types of databases are American Red Cross, which uses ArcNet, and this actually happens to be the world's largest database for blood donations. The Department of Defense uses something similar. It's a little smaller, of course, in scope, but no less important, called DIBS, or Defense Blood Standard System. That's what they use to track any of their blood units, which is then used to service their members or their families. That concludes my project on databases and blood banking. If you have any questions, please leave any comments, and I will answer them to the best of my ability. Thank you.